At the very early meetings, we were all concerned that this could be the potential to be a talking shop, and that would be completely at the opposite end of what we were trying to achieve here. This was people working with us, externally to us, challenging us to make improvements in care. So that was the goal, if you will, and we've stayed true to that. What we can see that the patient and public panel will tell you through evaluations, through their feedback, through the rest of the organisation's feedback, that we do listen. We change things that we can change, and if there was ever something that we couldn't change, we work together so that they understand why we couldn't change or why we couldn't achieve that particular goal, but then we work together to understand what is achievable, because not everything in life is achievable, but we do want that constant challenge, that yin and that yang of making sure that what we're worried about and what the public are worried about come together to drive improvements. And I think we've got fantastic examples of that, both in terms of patient care, but also in terms of the build of the hospital. The builders will tell you, and the evaluations from the hospital, that some things happened in the hospital, whether it was constructions of windows, placements of washing sinks and taps, types of taps, to the environment of which the children or the families would be passing through, perhaps in an area, is completely different from the original design. And I know that this organisation has presented even in other countries about our experience around that. So we do have positive impact, we've got evidence of that, and I believe that they have completely changed the culture. From patients and public panel being afraid to go into the room with doctors and nurses and wondering if they would be heard or listened to patient and public representatives and really challenging us, and they are incredibly challenging. Actually, it's one of the things I'm most proud of that I've done, and actually watching them continually to take knowledge and bring perspectives and not be afraid to really challenge us, but then work together to achieve something different for the patients or the services. It's been one of the most rewarding things. Tricky, but very rewarding.
I think the staff have realised that we aren't a threat, that we are there to work with them, and the success is not so. There's lots of little things that you probably have achieved, but the big overall thing is that I don't think now that you take something like the leaflet group it's in existence, and that they're not afraid to give us a leaflet to look at and change it if necessary.
Being in the wheelchair is a big reminder to staff that we've got to think about wheelchairs and all other disabilities. That has become more and more to the fore in the last 5-6 years, but sometimes you do need to remind them without running over their toes.
I'm actually chair of the steering group. I'm the vice chair of the safety group as well. And I attend the patient experience group. And I've been involved in I'm in the leaflet group as well, which I really enjoy, and I've been involved in going out to the wards and introducing leaflets to patients.
We had a full panel meeting in June and was asked if there was anybody who'd like to go on the CORTI group, which is catheter-acquired urinary tract infections. I have a catheter, so I put my hand up, and when the woman who's in charge of all this found out, she says, "Good, we need you," because it is a group that no matter how many years you have dealt with catheters in your work life, you do not have the experience of living with one. So I'm hoping to be a big influence on this group. You pick and choose the areas you're interested in. I have my finger in quite a few pies.
So it's all very well to discuss what you think patients want, and I'm not saying that every patient panel member knows what patients want either, but we can give a sort of perspective which otherwise might not be there. And in practical terms, we can go out and do surveys and ask people for their opinions of services. And particularly effective, as far as I'm concerned, has been the oncology work that I've been involved in.
It was an ambition, and I never believed that we could achieve something so important, so positive and so sustaining. I can't believe it's 10 years. They are completely different. They have continued to develop and challenge. We've got new members. There are a couple of few founding members, but the people have changed, but the ethos is still there, and that healthy challenge and that they bring, and the way that they challenge us to do better for people, I think is something that I'm internally grateful for, and I know that they've made a difference.
It's an important role because it gives the NHS an opportunity to see what the public think about what they're doing and for them to get involved. And I think the impression I have is that from the top down, they're very welcoming of us getting involved, and that's my experience.
I think it's amazingly worthwhile. I think there are all sorts of areas in which, in small ways, I wouldn't claim that we've changed the world, but we've chipped away. In fact, our previous chairman once said to me that I was like a dripping tap. So I think we're very good at persisting till things are improved.
It's not just for retired people, it's just, I suppose retired people have got more time so they can afford more time, but if you are a person who's got spare time at home, then you could get involved, because you don't need to be involved 100% of the time. As a volunteer, you can be involved as little, as much as you like to be involved. And clearly we should have a fairly good representation of the age profiles across the community. But that's difficult if you're working or if you've got young children, so it's inevitable that it tends to be people like ourselves that get involved at an older age.
Of course, we're going into the new world of health and social care integration. I think with the Communities Bill across Scotland, I think we're signalling more engagement from communities and patients and public rather than less. So I think what we've done gives us a great foundation. I think we will always need the public to be very close to hospital services, because often that's the areas they are most concerned about. But I think the opportunity to replicate something that we've done here across health and social care is great. And I think we will be able to do that. So I think we'll still be here. I think we may be different. I think people in Forth Valley will always want to come alongside us and encourage us to be world class. And again, I think that's what they've helped us do, and they will help us continue to do slightly different form.